Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Hey, there's a new news article which is very interesting. Never heard it before. I don't think it's ever been discussed before. Circumcision was linked to a 60% decrease in prostate cancer risk in black men. Just published in the British Journal of Urology International, so a very prestigious journal. In this study, black men were less likely than white men to be circumcised, 30% versus 40%, and more likely to have sexually transmitted infections when they were uncircumcised, 28% versus 10% when they circumcised. So we know that men who are circumcised have less sexually transmitted diseases, they have less cancer of the penis, their partners have less cervix cancer. But never before has there been a report that circumcision helps protect against prostate cancer. So the article written by Amy Cadron said that circumcision appeared to protect study groups against prostate cancer, but associations did not reach statistical significance except in men circumcised at 36 or older and in black men. We're going to take this caller. 1 minute. Good morning. You're on the radio.
Can I get a free booklet on prostate cancer?
You certainly can. Just call the same number, the 212 Choices, Monday through Friday, 9 to 5. Our business office is open. They'll get your name and address and put it in the mail to you at no charge. 9 to 5, Monday through Friday, normal business hours.
Okay, not Saturday and Sunday, right?
Monday through Friday, 9 to 5. Leave your name and number, and we will put it in the mail immediately.
Okay, thank you very much.
Thank you. God bless you. Bye now. And who thinks the doctor doesn't answer the phone? So it's interesting. Circumcision was linked to 11% decrease in prostate cancer overall. It didn't reach significance statistically except in black men, and in black men circumcised at age 36 or older. So is circumcision worthwhile? You may want to look at this article. It talks about cutting prostate cancer in the patient. There's other reports about reducing sexually transmitted diseases, penis cancer, and cervix cancer in partners. Another patient I want to talk about, very interesting woman, 65-year-old woman, came from Soviet Union. She had endometrial cancer, so the typical woman with endometrial cancer is diagnosed like this woman with vaginal bleeding. So she had postmenopausal vaginal bleeding. She went to a very big hospital, which the family viewed like a church or something, a religious institution. They did surgery on her. They did standard chemo and radiation on her 2 years ago. They did cancer markers on her, and then in 2013, the cancer came back. They started chemotherapy. She had 8 months of chemo. It never worked, and they continued the chemo. Can you believe it? It never worked, and they continued the chemo. It's great if it works, maybe, but if it doesn't work, why would you want to keep it? She came to see me, and as I say, I spent about an hour, or this patient was about 2 hours, talking to her. She had lost 20 pounds. She had headaches. She had numbness under the right eye. And she told her doctors at this big hospital, but it seemed like they just wouldn't listen to her. Her cancer markers were going up. They just giving the chemo that didn't work. And finally she came to me, and they were so afraid. Oh, what will I tell my other doctors? Well, okay, we got a test of her head, and we got an MRI, and the first report from the MRI said it was normal. And normally I would call up the radiologist with the patient in the room and go over the test. I said, now, this woman has numbness under the eye. I believe that the trigeminal nerve on the right side is being pinched by cancer. And they showed it to a second doctor. Said, no, it's okay, it's okay. And then they showed it to a third doctor who found the cancer pinching the nerve, and everyone apologized. Oh, Dr. Lederman, how did you know? Well, how do you know? It's simple. You listen to the patient. Like my grandfather always said to his doctor, come in, close the door, sit down, and stay a while. And if you listen to the patient, you'll really be smart. So this patient had been going elsewhere to a super hospital, one of those that has full-page ads in the New York Times all the time, but they wouldn't listen to her. Listening to this patient, found the cancer that was causing the nerve to be pinched off, and we're doing radiosurgery to hit the cancer, just that little spot. It's a very little spot, but it's a spot that's so critical. So the 5 treatments, non-invasive treatments, each one's focused on that spot, and most likely that cancer will stop, and hopefully her symptoms will go away, the numbness in the face and the headaches. We gave her a little medicine to help relieve the swelling. So she got the medicine, the radiosurgery, 5 treatments, and we'll follow her. We get report cards on our work for you. So she'll have a follow-up scan to show that what we treated has stopped or shrunk or hopefully even gone away. And by the way, she has very extensive cancer in the liver also, causing a lot of pain, causing her liver to fail. And she wants us to do radiosurgery for endometrial cancer, metastatic to the liver, which we'll be doing simultaneously. Hey, it's a lot better than chemo that didn't work. I gave her all the options, from everything from no treatment to chemo to radiosurgery to other things. And at the end, the family said, oh, we were supposed to get topotecan tomorrow. Should we get topotecan tomorrow? Topotecan is a kind of chemotherapy. I said, chemo hasn't been working for a year. If you think topotecan is going to change something, take it. I think it's useless. So we got the MRI. We actually checked her feet for swelling. She had swollen feet and blood clots are the number 2 killer in cancer patients. So we checked her feet, we checked her head, we checked her body, we got her going, we got her off of the chemo that was useless and getting her treatment with something that has a chance, pretty good chance, to stop the cancer. Hey, I often talk about hospitals, and there's an article in the New York Times this week by David H. Newman. He's an emergency room doctor, and he thinks he's discovered something called the post-hospital syndrome. Now, what's the post-hospital syndrome? Well, you might be interested. And he writes, it's been long known that hospitals can be the source of illness. 1.7 million Americans develop hospital-acquired infections each year. Post-hospital syndrome is something different and more ominous. So I don't know if it's more ominous because about 10% of those 1.7 million Americans die from their infections. But it's an interesting idea. There was a paper he quotes by Dr. Harlan Krumholtz, a professor from Yale, who described a syndrome that emerges in the days and weeks after a hospital stay. Quote, physiologic systems are impaired, reserves are depleted, the body cannot effectively avoid or mitigate health threats. He called this period of vulnerability post-hospital syndrome, and goes on to say the post-hospital syndrome was identified as a result of new Medicare rules that hold hospitals responsible for readmissions within 30 days after discharge. The health system started studying patients who returned to the hospital after discharge, and there were two facts. One is the problem is common and widespread, occurring after nearly 1 in 5 hospitalizations of patients on Medicare. And more surprising, the majority of the cases represent an illness distinct from the first hospitalization. So people are in the hospital for one reason, and then they come back often for another reason. And this is called the post-hospital syndrome. And they go on to say post-hospital syndrome is not a relapse. It's a state of susceptibility that leads to a new affliction, infections or complications of a hospital stays, but that's just one small category. Other reasons to go back to the hospital: heart failure, gastrointestinal conditions, mental illness, nutritional problems, electrolyte imbalance, and trauma from falls and weakness. These aren't my words. This is Dr. Newman writing about the risks of being in the hospital. So how do you fix it? Well, you have to fix the hospital. He goes on to say beeping machines, needle sticks, unpredictable waits to see the doctor, unappealing food, and sleep deprivation are among the barrage of stresses he cites. The result is that hospital patients are deconditioned, in pain, malnourished, stressed, with disruption to their day-night cycle. And we ask, why do patients return to the hospital? Maybe it's because what we've done to them. Wow. This is what I've been talking about. Don't you want to stay out of the hospital? People ask me so often, do you treat as outpatient or in a hospital? We treat as outpatient. Our patients want to sleep in their own bed. They want their own food. They want to be with their own loved ones in their own environment. They want to work and carry on their normal life. A treatment with us is 15 minutes. You come in, get a treatment, and you go back to your normal lifestyle. You don't have the risks of super infections and needle pokes and all those things that Dr. Newman was talking about. So, wow, why should we go to the hospital when there's 1.5 million infections, a substantial number of those patients die from those infections, and other complications? It's in the New York Times. I'm not making this up. Everything I say it has a source, data backed, and this does too. We're going to hear from our sponsor, and then we'll be back. If you have questions, call us at 1-800-848-9222. I'm Dr. Lederman for the Radiosurgery Hour. We're talking about cancer treatment. We're a cancer treatment center in the middle of Manhattan. It's a private center. We work for you, not the drug companies, not the surgeons. You are our boss at Radiosurgery New York, and you'll see how it makes all the difference in the world. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, cancer, it's not prejudice. It strikes everyone. We've seen the racists with the big C. We've seen humanitarians struck down with the big C. But there are remedies, even if you've already had different measures of treatment, like prior chemo.